Hi, welcome to RefinedMD. I'm Eric Keys, and today for our Lunch and Learn series, we're going to be focused on combination treatments. This is a wonderful way to maximize the value of your time in our office and to get optimal results. We're going to be hearing from RefinedMD's own facial plastic surgeon, Dr. Sudeep Roy. And Dr. Roy will be discussing the benefits of treating the nose via rhinoplasty, chin augmentation, and possibly submentoplasty or some combination thereof. Later in the video, I will be returning and I will be discussing the value of some non-surgical, non-invasive combinations such as lasers and fillers or filler in two different areas and whatnot. That's going to be for our patients that are not interested in surgical options. So stand by for that. First, let's go to Dr. Roy now and see what he has to say.
Two, three. 1, 2, 3. 1, 2, 3. Sorry. And 1, 2, 3. Okay. We're good. So that, basically created a 3D image of Liz's face. You can spin it around, right? And then there's 3 modules. There's rhinoplasty, chin augmentation, and then just general contouring stuff. I use this software a lot for rhinoplasty modulations and simulations, but I also find them pretty useful for chin augmentation. So this is basically a few points that get assigned to the image so that then we can alter them using a set of predetermined. So now I'm going to go into the chin augmentation analysis mode. It's usually in the lateral view. Before I do that, actually, what I'm going to do is I'm going to orient her appropriately. So this is usually the orientation that we use to analyze chin projection as well as the nose. And now I'm going to start doing the simulation. In this case, you can see that basically, this is a lateral view of Liz's face, and you can kind of notice that the chin is a little receded there, right? So basically what this model allows me to do is basically simulate what a chin implant might look like, right? And I have to be realistic as to kind of what I feel like is an appropriate augmentation with the chin implant sizes that we have. And I'll walk through, a patient, and the two of us would then get together and make a decision as to where we want to do it. You can see that to some extent these simulations are a little limited. This is just moving the chin itself, but the soft tissues in the lower lip area do come up a little bit. So this little indentation here is not necessarily something that that happens, so sometimes I'll kind of push that out to simulate something that's a little bit more anatomically reasonable, right? So you can see that here, we augmented Liz's chin. The nice thing about these kind of changes is that a very subtle change in the chin projection can also change the balance of other features in the face, such as the nose. So generally speaking, we notice that a weak chin can make the nose look longer. So if you just do a chin augmentation and project the chin out a little bit, the nose automatically feels shorter. So without doing a rhinoplasty, or a liquid rhinoplasty for that matter, the nose can just look more balanced and more appropriate for the patient's face just by augmenting the chin. The other thing that this does nicely is that for patients who have heaviness in the submental region, right? When I talk about doing procedures in the neck, it's really trying to improve that definition right there. Liposuction will remove superficial fat. I do some liposuction, but the vast majority of my neck practice is really based on a procedure called a submentoplasty, which is basically through a small incision underneath the chin. Yeah, we do a little bit of liposuction, but we also try and get rid of or reduce the deeper fat compartments in the neck. But for some people whose chin, and I'll just as an example, I'll go back to this, and I will kind of reduce the size, right? So let's just exaggerate. Oh my gosh, Liz has no chin almost, right? But what you can see is that that distance between the chin and the neck is much shorter than what this is, right? And so with someone who has a very receded chin, it's very difficult to get great definition in the neck because of this very limited length between that cervical mental angle right there at the hide bone to the chin, right? So it's really short. So the only portion that I'm going to be tightening, removing fat, and tightening the muscle is between this spot and that spot. And the shorter that spot is, the less significant that change will be after surgery, if that makes sense. So a lot of people, I would suggest, coming in for a chin augmentation, because you can see I've elongated that distance, and now when I do a neck procedure like a submentoplasty to tighten up the muscles and remove fat, they get a much better definition, and their jawline also looks much longer, right? So I think this is one of the most powerful combinations, is a chin augmentation along with rhinoplasty, or a chin augmentation along with neck contouring procedures. So previously, I chatted about the importance of chin and chin projection to just the general balance of someone's face. Adding chin augmentation can certainly change some of the unique features of a patient, such as the definition in their neck as well as their nose. A lot of patients find that their nose is really long appearing, and then when I see them in consultation, I notice that their chin is pretty receded. And I tell them, well, if you were to augment your chin, your nose would automatically look shorter. The chin augmentation is a great procedure, kind of like I mentioned before, to pair with rhinoplasty procedures for nasal contouring, as well as submentoplasty or neck liposuction procedures to better contour the neck definition. I wanted to show you a few examples of some befores and afters of patients that I find that really exemplify the power of a chin augmentation, and you'll see why. So we'll start off with chin augmentations as they pair with neck procedures, okay? So submentoplasties or neck liposuction. In this case, you can see that, this is the before, this is the after. And you can see that not only did this patient have fullness in the under chin area, and that's actually what she came to see me for specifically. She was like, you know what, I don't really like the fullness in that under the chin area. I want to get rid of it. I want better definition along the jawline and in the neck. What I noticed during the consultation is that her chin was fairly far back. It was a little receded. It was a weak chin. And so I basically talked to her about the limitations of just doing a neck procedure, because I didn't feel like doing the neck procedure would give her the best possible surgical outcome. In the after procedure, you can see that after doing a medium chin implant, as well as a submentoplasty with Renuvion skin tightening, and that's another treatment that I do that pairs really well with other procedures, and we'll talk about that in a different section. But you can see that how we elongated that distance between the neck and the chin, right? And just doing that, if I had just done that alone, I think that she would have had some benefit, but it was really the pairing of these two procedures that made a huge difference for her, and as you can see, it's most exemplified in this view. Another great example of such a case is this one. You can see here, again, heavy neck, very limited jawline visibility, and so the patient really came in for that specifically. She wanted more improvement in the contour of the neck. And again, on consultation, I recognized that she had a fairly weak chin. And so when I basically talked to her about my recommendations, I told her, well, not only should you consider doing some liposuction and a neck procedure to get a little bit better contouring in the neck, but I think that a chin augmentation would really, really help improve the overall result and the contouring effect of the procedure. In this particular case, and this is a conversation for another day, is there are some limitations in neck procedures that we encounter as surgeons. You can't really move your voice box, and if your voice box is set pretty far forward, there's only so much definition that you can get from a neck procedure, right? And so for those patients specifically, I think that if they wanted to maximize their neck results, chin augmentation really, really helps to improve that. Now, just providing an example of how chin augmentation can pair really well with a rhinoplasty procedure, I'm just going to show you an example of a patient who not only got a rhinoplasty but also got a chin augmentation. And again, most evident in the lateral view, you can see here There's a bit of a nasal hump, which made her nose look a little long. But not only that, she had a bit of a receded chin, and I think that's what made her nose look even longer and more droopy than it actually was, right? But in her case, I really felt like not only would a chin augmentation help improve the overall aesthetic of the nose, it would also help the overall aesthetic of the neck. And so we ended up doing a chin augmentation with a rhinoplasty. It's more of an ethnic nose, so we preserved some of her, ethnic features. It's not a really scooped out nose. That's not what she wanted. But you can see that, comparing the two images, this image is so much more balanced, and that's because not only did we address some of the issues going on with the nose, but we also gave her some projection in the chin, and I thought that made a huge difference, and she was really happy with that.
Now that you've heard about surgical options, let's talk about non-surgical options such as using toxins and fillers in the face. Toxins and fillers are a really good combination for achieving kind of the anti-aging and more of a youthful plumpness as well as restedness to the face. Typical areas that we use Botox or neurotoxins in are the glabella complex, that's the angry 11 lines between your eyebrows, your forehead, and your crow's feet. There are other areas on the face that we can discuss with you in personal consultation to optimize toxin results, but indeed they're less common areas of the face. Another aspect of facial rejuvenation is replenishing lost volume. Volume diminishes naturally beginning kind of in collagen production, diminishes in your late 20s. And so if you can replace that volume that is depleted because of the loss of collagen, your face appears more youthful. Areas that we can treat, or typical areas we can treat with fillers, are starting from the top down: temples, cheeks, nasolabial fold, melolabial fold, marionette lines, as well as strengthening your jawline. So those are the typical areas. I did leave one area out. It's a tricky area for some injectors, is the tear trough area, but sometimes people say that they come to us saying they appear tired and they feel like they've lost volume here, right in this area. So if we can replace that and kind of optimize their look, they look more rested at least. So, of course, at RefinedMD, we do kind of a surgical option for hair replacement, and that's called FUE, follicular unit extraction, where you pull follicles of the hair out of the back of the head normally and replace them in areas that are currently not growing hair. Some people, however, don't even want to get to that point of doing kind of a hair transplant because it's a little more costly procedure, although it's extremely valuable procedure. The option we have for hair replacement or hair maintenance in that case is we can either inject platelet-rich plasma or another kind of man-made substance that's called Carifactor, and we can somehow get that into your scalp. Either with PRP, we generally inject platelet-rich plasma, which is your autologous material that we draw blood, spin it down, inject it. It's kind of like fertilizing your scalp. Your scalp, the hair grows better. It involves a series of 4 to 6 injection sessions for optimal results. Carifactor is again a lab-based or lab-manufactured material that we essentially scratch your scalp using a laser. So we drill just little holes using a laser and through the areas that aren't growing hair or where the hair growth is compromised, and then we topically apply this substance. And then many times we can kind of halt the hair loss or actually improve the thickness of the hair in those treated areas. So we can also then combine either one of those two hair loss options, the PRP or the Carifactor treatment, with something called low-level light therapy. This is a diode laser that's in a form of like a baseball cap that you can wear, and the red light therapy actually stimulates your hair follicles to remain in the growth phase, so that again you have more hair follicles in the growth phase. Your hair is thicker and grows more fast with that light stimulation. That's something that you'd wear 3 or 4 times a week, and the treatment takes about 7-8 minutes. But it's a battery operated like baseball hat that you can kind of take anywhere, keep in your car, wear it while you're cooking in your kitchen, whatever you want to do. It's just important to get that low-level light therapy, for 7-8 minutes per day or every other day. So another popular combination in our office, especially at this time of year, is a combination treatment for skin laxity and and the appearance of cellulite. This, is a condition that plagues many people, both men and women. Although the cellulite is mostly restricted, it's a concern of women, but skin laxity crosses both genders. What we have in the office today, and this is like a very new treatment, is an injectable called Quo, and Quo is a enzyme that is synthesized in a laboratory. It's injected just kind of in the same manner Botox is injected, very small little needle just under the skin, right into the dimples that appear with cellulite. It melts the fibrous septi. Those are the tethers that hold your skin down to the lower levels in the skin. And when those tethers are released, the result is just a skin smoothening effect. So this is a treatment that usually requires 3 treatments in a row, separated by 21 days. We're one of the few offices in the country that actually have this FDA-cleared treatment. It's not available everywhere right now. I imagine it will be more in kind of general circulation by 2022. We like pairing this treatment, this injectable treatment, with a device-based treatment to smooth the kind of almost non-identifiable ripples that appear in people's skin, particularly on the backs and the front of the thighs. Those are caused both by cellulite as well as a little bit of impending or already there skin laxity. So we treat those with a device called M-Tone. M-Tone is a radio frequency combined with a radial shock wave, which is a kind of a mechanical form of energy that pounds the skin and delivers radio frequency energy at the same time. Again, the overall effect is to tighten the skin so it improves skin laxity as well as kind of smooths the skin. So that's a great combination treatment in our office and a great one to do for summer. So another great combination treatment in our office combines 2 different devices for skin rejuvenation and for kind of erasing browns and the effects of kind of sun on your skin. That combination is broadband light, also we refer to in our practice as BBL, and some modality of laser to pair with it. We can either use a thulium laser, which is called Moxie, or we can use another device called Halo. So either one of those combinations, broadband light with Halo or broadband light with Moxie, make an excellent skin rejuvenation regimen. What you achieve with using these 2 devices in common is erasure of browns, maintenance or abatement of reds in the face. So your reds are reduced, your browns are nearly erased, especially if you do this treatment twice. And then there are some anti-aging benefits, especially from the light-based treatment, the broadband light treatment. There have been some studies done at Stanford over 9 years ago that are well validated and had many, many participants in the hundreds. And they demonstrated the anti-aging benefit of broadband light, including changes at the cellular level in the epidermis. Tough word. So another great combination treatment that we implement in our office is restoration of the upper face. Often when people age, what they notice through bone loss and descent of fat pads is kind of loss of volume right here in the cheek area or the zygoma, as well as laxity of the upper eyelid skin. So what we like to do to treat those 2 areas in combination is to use our Thermage FLX. That's the latest rendition of the Thermage radio frequency skin tightening treatment. And we use a special tip that's designed just for the eye. So it's a very small treatment area. We put an eye shield in to protect your eyeball, and then it's a kind of in a stamping procedure. We deliver radio frequency energy over the upper eyelid tissue. That's both this infraorbital area and right on the eyelid itself, and we get that skin to tighten. This is not the equivalent of a surgical blepharoplasty, which is a procedure that removes skin in your upper eyelid, but this is simply a procedure that tightens the skin. So if your problem's severe, you'd probably benefit more from an upper eyelid procedure, which we can do right here in the office. Dr. Roy can provide more information, or his surgical consultant, if you schedule a personal consultation with him. But this is an alternative to that. So it gives you some result, definitely a visible, photographable result that we see consistently when we do this treatment in the office. And like I said, for total kind of upper face rejuvenation, we like to combine it with like filler in the cheek right here to improve kind of this whole zone. So upper eyelid tightening and a little bit of emphasis either on the cheekbone or even replacement of some volume, lost volume in the tear trough area, or those can be done together. Thank you. So thank you very much for watching our program today on combination treatments. It's been a pleasure having you and having a chance to discuss some of these, both surgical and non-surgical options. We truly believe that these treatments, when they're combined, maximize the value of your time. We understand it's valuable, so you come here once, you get 2 things or 3 things done. It aggregates all the healing time into one healing session. We also truly believe that the results when people employ these combination therapies, they actually get kind of 1 + 1 = 3 results, better results than either one treatment delivered independently. So again, we hope that you can find a chance to come in for a personal consultation in our office, and we can have a chance to make suggestions of what therapies might be best for you in combination.